When you're talking about chronic use of any psychiatric drug, you are heading down a road of problematic side effects and addiction. People do not understand that when they give you these drugs and prescribe them to you, they'll tell you you're going to be on these drugs for the rest of your life. And the reason they tell you that is because nobody knows how to get you off of them safely and comfortably. Because when you try to get off of them, most everyone has symptoms that mimic the exact same symptoms they were given the drugs for, but they're more severe. So what you're told is, for example, if you have an adverse reaction to antidepressants and you become manic psychotic, well, you know, what we thought that you had was a depressive disorder, but now we realize that this is part of a bipolar depressive spectrum because you've had this event, and therefore we're going to add another drug to your regimen, and you're going to be on these drugs for the rest of your life. And people accept that, and they walk away feeling that they're defective, that there's something wrong with them. And the fact of the matter is, many times, it's their poor dietary habits, it's their lifestyles, it's their psychological issues from childhood or from their marriage, or it's a number of other things, and they haven't even investigated what the real root cause of the problem is. And so what they do is start masking the symptoms with drugs, and then you get more symptoms, more drugs, and pretty soon you are what they tell you you were. They create the disease to treat. And it's not just in the psychiatric field, but it's the easiest place to do it because there are no tests required to diagnose a person with a psychiatric illness. There's no blood test, there's no urine test, there's no PET scan. You may have a little questionnaire that you can fill out that is very subjective, but they don't have any disease evidence. And that's what makes it so lucrative, because you're a potential customer, I'm a potential customer. Anyone that has a death in the family, has a divorce, has a bad day, has a bad job, whatever, they are a candidate for drugs. I want you to have this warning, and I want you to share it with every single person that you possibly can that you know that either is on antidepressants or has a child on these drugs. And that is that you cannot cold turkey off of these drugs. It may cost you your life. It is imperative that you titrate the dosage slowly, which means you reduce the dose slowly, just so that they can have more time, that the brain can recuperate, that the body can detoxify, and so that they don't have the severity of withdrawal symptoms that they would if they were to cold turkey off the drugs. And of course, I always advise people to get medical supervision. It may not be easy to get a psychiatrist to agree to take people off of their drugs. Because first and foremost, psychiatrists, they have a medicalized model, so there's a huge push to keep them prescribing drugs, because if the drugs are proven to be ineffective, what are all the psychiatrists going to do? If you can't find a psychiatrist that'll help you get off the drugs, then go to an alternative MD or an integrative care MD. That's usually somebody who can prescribe medication but also knows about alternatives, that they can make other recommendations besides drugs.
Started a new job, and I was feeling some anxiety, a little depressed. So that's when I got on. Effexor, and a few days after that, is when I started feeling that inner pain, feeling like I had to get out of my own skin. So basically what I do on a daily basis is I just pace, and I pace, and I pace, and I pace. If I don't pace and I sit, it makes everything a lot worse, and the pain inside gets worse. You know, a lot of people say that. Trust doctors, they know what they're doing. Until you find out that they don't. When you're hurt by something, a medication especially, the doctors almost become defensive when you're trying to tell them things like this, and their only answer is to try more drugs and try more drugs and try more drugs.
It just got worse, and it did not occur to me at all that the medication had anything to do with it.
This is what 5 years on antidepressants has done to a little boy, 10-year-old Seth. Before this, Seth was an anxious but otherwise happy child.
I got a bird, finally.
Seth was 5 when Mum Donna was recommended the antidepressant Aropax, also known as paroxetine, by their family GP.
She didn't actually see him to diagnose anything.
The GP also failed to advise of any possible side effects. At first, the drug appeared to help with Seth's anxiety, but after a week, he turned aggressive, angry, and violent. Believing the medication wasn't strong enough, Seth's paediatrician increased his dose. How bad did it get?
The saying of the day became, "Why did you have me? I don't want to be here anymore."
Seth has been in and out of hospital.
I trusted the doctors. Doctors trusted the pharmaceutical companies.
Is it safe for kids to be prescribed antidepressants?
Absolutely not. To be approved, the drug has to beat a sugar pill in 2 clinical trials, and they can do 1,000. It's known as legal fraud. The worst and most dangerous side effect is called akathisia, which is a can't-sit-down restlessness associated with thoughts of violence, which turned in on oneself become suicide, or turned out become homicide, even mass homicide.
Akathisia is commonly mistaken for psychosis, but there is a big difference.
These are substance and medication-induced disorders, which are toxic states. They're toxic states like being drunk is a toxic state.
Seth is being weaned off Aropax under professional supervision.
I'm so glad that we know now.
Our society has become very confused about psychiatric drugs. We've been told that they fix chemical imbalances, they help people live normal lives. And yet, what has happened in the last 20 years? As a society, are we seeing a reduction of the burden of mental illness in our society? Not at all. We have more people depressed. There's been an explosion of bipolar patients. Now we need to ask, what's going on? And why do we keep doing it if it's not working? There's a couple reasons why I think we keep doing it. One is it is a commercial story. So pharmaceutical companies basically tell us a story that these drugs are very effective and you got a chemical imbalance. So it is a story about how the pharmaceutical industry, and in collaboration with psychiatry, frankly, they've put out this image of human beings very happy, and that their mind's this settled place, sort of, and it's not a place where you feel sad or grief or anxiety. All these emotions that we actually do know are very common to human beings, especially anxiety. But they have told us a story, that's a disease to feel anxious. And they're also telling us a story, we have this magic pill to eliminate that disease. And then once that story gets fixed, habits get fixed. Doctors start saying, oh, this is what I do when someone comes and complaining about some stress in their life. I prescribe an SSRI, and I get reimbursed for that. And you basically get these patterns set up where the whole society is set up to act in this way. Insurance reimbursement, and belief systems, and doctors. And even when you see bad outcomes, you see more people depressed, you see disability rates rising in our country, it doesn't seem like there's a good mechanism for checking this and for us to say, maybe we should try something different, like diet or exercise. We have made extraordinary wide use of psychiatric drugs, and at all ages. You know, we're putting 5-year-olds, 6-year-olds, youth on these drugs. Now, we have had a lot of high-profile killings in the last 20 years, and there's obviously a lot of cultural factors involved. But there's a pretty strong strain in the literature that these psychiatric drugs can, in fact, stir homicidal ideation, such as SSRIs. Do they increase the risk of suicidal and homicidal ideation? It's quite clear that they do. I think there's two things that may be going on with the psychiatric drugs and violence. One is something, the drugs can stir something called akathisia. Akathisia is this inner agitation where you just feel like you can't get comfortable anywhere. People almost talk about it as an inner torture. Akathisia is well known to be associated with violence and risk of homicidal ideation and homicidal behavior. Now, I think there's another thing, and this is more speculative. You know, with some of these drugs, you actually get a diminishment in your frontal lobe activity. And our frontal lobes are a part of our brain that say, hey, do this or don't do this. It's the part of this that makes us human and allows us to monitor our activities. And if you lose that monitoring, you may be losing some self-reflective behavior that would, when a crazy idea like shooting someone comes up in your head, normally the frontal lobes would say, well, that is a really bad idea. Do antipsychotics diminish frontal lobe activity? Absolutely. And there is some evidence that SSRIs sometimes can do it as well. Academic psychiatry is preserving, one of its products, which is psychiatric drugs, and that's a big reason for it.